over the last 40 years, you've seen a lot of people who've lived on the Atkins, Paleo, or other low-carb diets. What have the short and long-term results been for the people who followed this diet?
Anyone.
Anyone who wants to comment on that?
Anyone.
I could start. Basically, I've been in practice for approximately 28 years now, and I've seen many people get into trouble following various fads and hypotheses that they're, however, we have to give more credence to studies that track thousands of people, and they follow thousands of people for decades. And the studies, we give more credence that use hard endpoints. The hard endpoints are things like death, cardiovascular events like heart attacks, or cancer diagnoses, have more credence than a study that's just checking weight or checking cholesterol. We can show any study, short-term study, we can show a Twinkie diet is beneficial if we, by losing weight and lowering your cholesterol, if we feed people less calories and they get sick of eating just Twinkies and they consume less calories. The point I'm making is we need to give more credence to long-term studies. And we do that. We follow people, and we have these studies that are published in the medical literature today that follow thousands of people. Like, for example, one study followed 6,000 people for 18 years, and they had 400% increased death increased cancer death in those people eating higher amounts of animal products, 30% of calories compared to those eating less than 10% of calories. It's one study, but I can name multiple studies, scores of them, that show that as animal protein increases in the diet, so do both cancer deaths and cardiovascular deaths and overall mortality. So I think that the question about paleo-type diets that are generally high in animal products, and what was the other diet you mentioned?
Atkins.
And the Atkins diet, yeah. I think that's not a question that really is controversial anymore. I think that it's true that they're still popular. It's true that a lot of people are doing it. But I think among nutritional scientists, even the World Health Organization, and at least 90% of people into human nutrition who've read who follow the literature, I don't think among nutritional research there's any controversy at all left that these diets shorten human lifespan.
And I'll just add a little bit to that. Is my mic? Oh, there it is. My presentation on Monday is about the Paleolithic diet and a lot of the claims and what we know in the research that Dr. Furman was talking about. But just to add a little bit to that, we have literally dozens and dozens of studies, as you were saying, and one that was quite convincing, I think it was 2013, a study out of Harvard that followed people doing these kinds of low-carb diets for a number of years. And if I'm not mistaken, I think it was 50-some% increase in mortality, and or one or the other, 51% and then 34% or something increase in heart disease deaths. And so long term, what you're doing when you're eating that kind of diet is you're making your body more acidic, more prone to kidney stones and kidney disease, and of course to cardiovascular disease. And so I think a lot of people, what they care about is weight loss. And in a culture where you've got, at least 70% of people are overweight or obese. And if you go with Dr. Furman's numbers of a BMI of under 23, 88%, as you were saying today. And people go on a diet where they're eating mostly meat and a little bit of non-starchy vegetables, as many of these diets suggest. Of course they're going to lose weight. They've just cut out all of the processed white flour products and the burgers and the pizza, and they've cut all of that out. So of course they're going to lose weight. When you lose weight, you start to feel better. And what they're not recognizing, it's sort of long-term pain for short-term gain really is kind of what you're doing when you adopt this type of diet. But for those of you that can't be at the paleo presentation, I just want to tell you that even if these diets were the healthiest diets, bar none, a diet really is only as healthy as it is good for the planet and our population and for other creatures and for biodiversity and so on. If every single person on the face of the earth ate a paleo diet, today we would need 15 planet Earths to sustain the current population. It's insanity. And, you know, we really have to look, as I was saying earlier today, we've got to look at the consequences of our choices beyond ourselves. We've got to start to do this.
I want to add that one hot dog increases the risk of colon cancer, right? One hot dog. And so it's about the microbes, it's about the bacteria flora. As soon as you start eating meat, let's say you were a vegan and you ate only plant-based, you actually change the bacteria flora, and now you are increasing the risk for colon cancer big time. And this has been in studies. We know that for sure a vegan bacteria flora does not promote colon cancer. So it's very much about changing the microbes and the bacteria. And you're actually inviting subpopulations that the bad guys come in, the amoebas, the E. coli, and all kinds of bacteria that should not be there. We have a lot of friendly bacteria, and if I'm not in a good place, please take really good probiotic and enzymes to get you there.
I certainly think 5 planet Earths are sufficient.
Maybe Earths without humans are really sufficient.
Right.